Occasional forgetfulness can be perfectly normal, but speaking with a healthcare professional is a good idea if you notice recurring issues that interfere with your daily life. Here's what you can do. 1. Track your symptoms. Keep a journal of your memory lapses or cognitive difficulties. Note the frequency, duration, and impact of these episodes. Are they becoming more common? Are they affecting your ability to function normally? This information will be helpful if you decide to consult a doctor. 2. Consult a doctor. A healthcare provider can perform cognitive tests and evaluate your overall health to determine whether your symptoms might be related to dementia or another condition. Remember, many other factors such as stress, sleep disorders, medications, or nutritional deficiencies can cause memory problems that are treatable and reversible. 3. Involve loved ones. Family and friends can provide valuable insights into whether your memory and cognitive abilities have changed. They can also support you emotionally and help you navigate seeking professional help. 4. Adopt brain-healthy habits. Whether or not your concerns are validated, practicing habits that support brain health is always a good idea. These include staying physically active, eating a healthy diet rich in fruits, vegetables, and whole grains, maintaining social connections, challenging your brain with puzzles, learning new skills, or reading. Detecting dementia early can be difficult because the symptoms often overlap with normal aging, stress, or even depression. While we may not always recognize the signs of dementia in ourselves, several tools and tests, like those mentioned earlier, such as the Minicog or SAGE tests, can help identify areas of concern. However, these tools should be used as a starting point, not a definitive diagnosis. It's natural to be concerned about cognitive health, mainly if dementia runs in your family or if you've noticed changes in your memory. But it's important to recognize that occasional forgetfulness doesn't automatically signal dementia. Many people experience memory lapses, especially as they age, without developing any severe condition. The key is to remain vigilant without becoming overly anxious. By paying attention to your cognitive abilities, involving loved ones, and seeking professional advice when needed, you can address your concerns and take steps toward maintaining long-term brain health. Remember, early detection and intervention can make a significant difference in managing dementia if it does arise. So don't hesitate to seek help if you feel it's necessary. There is no single test that can definitively diagnose dementia, including Alzheimer's disease. Instead, diagnosis is made through a comprehensive evaluation that examines various aspects of a person's health and cognitive function. This process involves ruling out other potential causes for symptoms and taking a holistic view of the individual's medical, neurological, and cognitive condition. Let's dip into some DIY tests for dementia. We'll call the first test the Quick 6. For the first test, you'll need a partner to read your questions, or you can read the questions for your partner. The questioner needs to write down the score for each question. At the end of this session, add up the score to give you a total of 28. So, you've got your pen and paper. Now, you need to find a random unknown address. Before you begin, the questioner must create this random address of 5 parts. The important thing is that it must be an unfamiliar address with 5 parts. For example, 1 Billy, 2 Wright, 3 33, 4 The Avenue, 5 London. So, you've got your pen and paper. I want to talk to you about a book available on Amazon called Self-Tests for Dementia. I have permission from the author, Peter Yexley, to reproduce some of the content in this video, so you can try the self-tests at home. Why should you do this? Being concerned about whether you, a loved one, or indeed friend, might be on the verge of developing dementia is completely natural, especially as we age. While many of us experience the occasional senior moment, forgetting where we left our keys, blanking on a name, or momentarily losing track of what we were doing, it's easy for these slips to trigger deeper worries, particularly if we have friends or family members who have been diagnosed with dementia. The challenge lies in distinguishing between normal age-related forgetfulness and the early signs of cognitive decline that could indicate dementia. The big question becomes, how do we know whether these lapses in memory or focus are just harmless episodes or early warning signs of something are more serious? We need to try and understand so-called senior moments versus dementia. Senior moments are a standard part of the aging process and happen to people of all ages. These are typically fleeting instances of forgetfulness or mental fuzziness that are frustrating but not disruptive to everyday life. For example, and I must add, even young people experience this. Walking into a room and forgetting why you went there, misplacing your glasses or phone but being able to retrace your steps and find them, occasionally forgetting someone's name, only to remember it later. Let's get this straight. These minor memory lapses are okay and can be linked to stress, fatigue, or the brain's natural slowing with age. While they can be frustrating, they typically don't interfere with your ability to live independently or manage daily tasks. Now, on to dementia. This baddie involves more severe and persistent cognitive impairments that go beyond simple forgetfulness. It affects memory, thinking, reasoning, and the ability to carry out daily activities. Dementia-related issues are more frequent, severe, and disruptive. They can include consistently forgetting recent events or conversations, getting lost in familiar places, difficulty managing finances, making decisions or following instructions, repeatedly asking the same questions or telling the same story, unaware that you've already done so. Can we recognize dementia in ourselves? One of the most significant challenges in detecting dementia is that it often develops gradually, and people may not recognize the changes in themselves. This is partly because early symptoms can be subtle and mistaken for typical aging. Also, as dementia progresses, it can impact a person's ability to understand or acknowledge that they are experiencing cognitive decline. This is known as anosognosia, where a person is unaware of their memory problems. However, in the early stages, some individuals do notice changes in their cognitive abilities, and this self-awareness can prompt them to seek medical advice. Early signs that might prompt concern include increasing difficulty in planning or problem solving, trouble finding the right words during conversations, forgetting appointments or essential dates more frequently, struggling to keep track of multiple tasks, or becoming easily confused in previously manageable situations. Okay, family members, friends, or colleagues are the first to notice signs of cognitive decline. They might observe changes in your behavior, mood, or memory that you don't see yourself. These observations can be critical to the diagnosis process, as outsiders may be able to detect patterns that the person experiencing cognitive decline may overlook. What should you do if you're worried? If you are concerned about your memory or cognitive abilities, it's essential to take those concerns seriously, but not to panic. Occasional forgetfulness can be perfectly normal, but speaking with a healthcare professional is a good idea if you notice recurring issues that interfere with your daily life. Here's what you can do. 1. Track your symptoms. Keep a journal of your memory lapses or cognitive difficulties. Note the frequency, duration, and impact of these episodes. Are they becoming more common? Are they affecting your ability to function normally? This information will be helpful if you decide to consult a doctor. 2. Consult a doctor. A healthcare provider can perform cognitive tests and evaluate your overall health to determine whether your symptoms might be related to dementia or another condition. Remember, many other factors such as stress, sleep disorders, medications, or nutritional deficiencies can cause memory problems that are treatable and reversible. 3. Involve loved ones. Family and friends can provide valuable insights into whether your memory and cognitive abilities have changed. They can also support you emotionally and help you navigate seeking professional help. 4. Adopt brain-healthy habits. Whether or not your concerns are validated, practicing habits that support brain health is always a good idea. These include staying physically active, eating a healthy diet rich in fruits, vegetables, and whole grains, maintaining social connections, challenging your brain with puzzles, learning new skills, or reading. Detecting dementia early can be difficult because the symptoms often overlap with normal aging, stress, or even depression. While we may not always recognize the signs of dementia in ourselves, several tools and tests like those mentioned earlier, such as the Minicog or SAGE tests, can help identify areas of concern. However, these tools should be used as a starting point, not a definitive diagnosis. Occasional forgetfulness can be perfectly normal, but speaking with a healthcare professional is a good idea if you notice recurring issues that interfere with your daily life. Here's what you can do. 1. Track your symptoms. Keep a journal of your memory lapses or cognitive difficulties. Note the frequency, duration, and impact of these episodes. Are they becoming more common? Are they affecting your ability to function normally? This information will be helpful if you decide to consult a doctor. 2. Consult a doctor. A healthcare provider can perform cognitive tests and evaluate your overall health to determine whether your symptoms might be related to dementia or another condition. Remember, many other factors such as stress, sleep disorders, medications, or nutritional deficiencies can cause memory problems that are treatable and reversible. 3. Involve loved ones. Family and friends can provide valuable insights into whether your memory and cognitive abilities have changed. They can also support you emotionally and help you navigate seeking professional help. 4. Adopt brain-healthy habits. Whether or not your concerns are validated, practicing habits that support brain health is always a good idea. These include staying physically active, eating a healthy diet rich in fruits, vegetables, and whole grains, maintaining social connections, challenging your brain with puzzles, learning new skills, or reading. Detecting dementia early can be difficult because the symptoms often overlap with normal aging, stress, or even depression. While we may not always recognize the signs of dementia in ourselves, several tools and tests like those mentioned earlier, such as the Minicog or SAGE tests, can help identify areas of concern. However, these tools should be used as a starting point, not a definitive diagnosis. Occasional forgetfulness can be perfectly normal, but speaking with a healthcare professional is a good idea if you notice recurring issues that interfere with your daily life. Here's what you can do. 1. Track your symptoms. Keep a journal of your memory lapses or cognitive difficulties. Note the frequency, duration, and impact of these episodes. Are they becoming more common? Are they affecting your ability to function normally? This information will be helpful if you decide to consult a doctor. 2. Consult a doctor. A healthcare provider can perform cognitive tests and evaluate your overall health to determine whether your symptoms might be related to dementia or another condition. Remember, many other factors such as stress, sleep disorders, medications, or nutritional deficiencies can cause memory problems that are treatable and reversible. 3. Involve loved ones. Family and friends can provide valuable insights into whether your memory and cognitive abilities have changed. They can also support you emotionally and help you navigate seeking professional help. 4. Adopt brain-healthy habits. Whether or not your concerns are validated, practicing habits that support brain health is always a good idea. These include staying physically active, eating a healthy diet rich in fruits, vegetables, and whole grains, maintaining social connections, challenging your brain with puzzles, learning new skills, or reading. Detecting dementia early can be difficult because the symptoms often overlap with normal aging, stress, or even depression. While we may not always recognize the signs of dementia in ourselves, several tools and tests like those mentioned earlier, such as the Minicog or SAGE tests, can help identify areas of concern. However, these tools should be used as a starting point, not a definitive diagnosis. It's natural to be concerned about cognitive health, mainly if dementia runs in your family or if you've noticed changes in your memory, but it's important to recognize that occasional forgetfulness doesn't automatically signal dementia. Many people experience memory lapses, especially as they age, without developing any severe condition. The key is to remain vigilant without becoming overly anxious. By paying attention to your cognitive abilities, involving loved ones, and seeking professional advice when needed, you can address your concerns and take steps toward maintaining long-term brain health. Remember, early detection and intervention can make a significant difference in managing dementia if it does arise. So don't hesitate to seek help if you feel it's necessary. There is no single test that can definitively diagnose dementia, including Alzheimer's disease. Instead, diagnosis is made through a comprehensive evaluation that examines various aspects of a person's health and cognitive function. This process involves ruling out other potential causes for symptoms and taking a holistic view of the individual's medical, neurological, and cognitive condition. Let's dip into some DIY tests for dementia. We'll call the first test the Quick 6. For the first test, you'll need a partner to read your questions, or you can read the questions for your partner. The questioner needs to write down the score for each question. At the end of this session, add up the score to give you a total of 28. So, you've got your pen and paper. Now, you need to find a random unknown address. Before you begin, the questioner must create this random address of 5 parts. The important thing is that it must be an unfamiliar address with 5 parts. For example, 1 Billy, 2 Wright, 3 33, 4 The Avenue, 5 London. So, you've got your pen and paper. In the book, numbers in square brackets denote the 5 parts. The example is 1 Billy, 2 Wright. So this is any first and last name. 3 is a house number, and 4 the street name. Finally, 5 is the town. So, you have a full name and address in 5 segments. Remember, the questioner writes down and reads out the name and address. Let's assume you are the questioner. Clearly read the name and address you created to the person being tested. In this case, it is this example, Billy Wright, 33, The Avenue, London. This is a verbal test, so the answers must be spoken. Armed with this name and address, recite it to your partner. Ensure you are speaking clearly. Ask the participant to remember it. Next, you move on to a set of 6 familiar questions. 1. What year is it? The score for the correct answer is 0. And the score is 4 for an incorrect answer, 2. What month is it? The score for the correct answer is 0 and the score is 3 for an incorrect answer, 3. Without looking at a clock, what time do you think it is to the nearest hour? The score for the correct answer is 0 and the score is 3 for an incorrect answer, 4. Count backwards from 20 to 1. Score 0 if there are no errors, 2 if there is only one single error, or 4 for 2 or more errors. 5. Recite the 12 months of the year in reverse order. Score 0 if there are no errors, 2 if there is just one single error, or 4 for 2 or more errors. 6. What was the name and address that I gave you earlier? Score 0 if there are no errors, 2 if there is just one single error, 4 for 2, score 6 for 3 errors, 8 for 4 errors, and 10 if the name and address are entirely wrong. What's the score and how do you understand it? If the score is 0 to 7, there is no sign of memory problems. If the score is 8 or 9, there is some evidence of memory problems. See your doctor as soon as possible. If the score is 10 to 28, there is a higher level of evidence of memory impairment. See your doctor as soon as possible for further investigation. Simple word tests can be an effective and accessible way to detect potential memory problems. These tests tap into the brain's ability to recall and categorize information, helping identify any cognitive challenges a person might face. By evaluating how quickly and accurately someone can retrieve words from their memory, early signs of memory impairment or cognitive decline can be revealed. Now for the word recall test. Our brain is a vast warehouse that stores our life's memories. It is divided into departments and files. Throughout our lives, we accumulate a vast vocabulary. Storing words and their meanings in different departments, this information is typically accessed effortlessly when we communicate, allowing us to use words fluently without pausing to think about their definitions or associations. However, if someone struggles with word retrieval or confuses similar words, it can indicate that their memory or cognitive processes are experiencing difficulties. Imagine a little man inside the huge warehouse and you ask him to go and fetch a name, but he rushes off, but it doesn't seem like he's coming back with the name anytime soon. Let's look at word recall and memory problems. Problems with word recall are often early indicators of memory issues, which can range from mild cognitive impairment to more serious conditions like dementia or Alzheimer's disease. When someone struggles to remember familiar words or frequently uses incorrect or unrelated words in conversation, it may suggest their brain is having trouble accessing stored information. Additionally, patterns of word retrieval can also offer insights. For instance, repeating words. If your partner repeats the same word multiple times, this could suggest difficulties with short-term memory. Off-topic words. If someone names objects that don't fit the category, such as listing non-animals during the animal test, this could point to confusion or impaired executive functioning. Limited variety. Naming only a few items, despite knowing many more, may highlight slowed thinking or diminished mental flexibility. It's important to note that one poor performance on these tests does not automatically mean someone has dementia or another serious condition. Stress, fatigue, or even temporary distractions can affect test results. However, consistent difficulty across multiple attempts may warrant further evaluation by a healthcare professional. Additional word-based tests. Beyond the animal and fruit naming tests, there are other similar exercises that can also help detect memory problems. Letter fluency test. Ask your partner to name as many words as they can that start with a specific letter E, G, S in 1 minute. Category fluency test. Ask your partner to name all the objects in a particular room, such as a bathroom, living room, shed, etc., or all types of vehicles they can think of in 1 minute. Why these tests work. Word association tests engage multiple regions of the brain simultaneously. They require memory recall, language processing, categorization, and mental flexibility, all essential cognitive functions. When a person struggles with word retrieval, it may be because the brain has trouble accessing these interconnected systems. For this reason, healthcare professionals often use simple word tests to screen for memory impairments, particularly in older adults. These are the next steps if issues are detected. If these word recall tests reveal potential memory issues, it's important to follow up with a more comprehensive cognitive assessment. If someone consistently scores lower than expected, it's important not to jump to conclusions. Instead, it's a sign that they might benefit from further cognitive testing or a medical evaluation to rule out any underlying causes. In conclusion to this part, simple word association tests are an effective and easy way to spot potential memory problems. These tests can provide early clues about cognitive decline by assessing a person's ability to quickly and accurately retrieve words from memory. Whether you're concerned about your memory or that of a loved one, these exercises can be a helpful tool in detecting early signs of cognitive impairment. However, it's essential to remember that these tests are just one part of the puzzle, and professional evaluation is necessary for a definitive diagnosis. The clock drawing test. This is one of the most effective and widely used at-home tests for assessing potential memory problems or early signs of cognitive decline, including dementia. It's a simple, quick tool that can help determine whether an individual may be experiencing difficulties with memory or cognitive functioning. This test is commonly administered by general practitioners, GPs, and dementia specialists as part of a broader assessment. Although it is not a definitive diagnostic tool, the clock drawing test can provide early indications that further investigation may be necessary, particularly if the results suggest cognitive impairment. Its simplicity and accessibility make it a useful initial screening method for anyone concerned about their own or a loved one's memory. How to perform the clock drawing test at home. The clock drawing test is straightforward and can be performed using only a blank piece of paper, preferably a 4 size to give the person enough room to draw freely. Follow these steps to administer the test. Why the clock drawing test works. The clock drawing test is valuable because it engages multiple brain areas. To complete the task, the person must use memory, recalling the correct number placement and clock structure, executive functioning, planning and organizing the task in a logical sequence, motor skills, the ability to draw numbers and hands accurately. Because dementia affects these cognitive areas, the test is often effective in detecting early signs of decline. While the test alone cannot diagnose dementia, it is a red flag that further testing or evaluation by a healthcare professional may be necessary. When to seek professional help. If the clock drawing test results are concerning, such as consistently misplaced numbers, failure to draw the clock hands correctly, or difficulty completing the task, it's essential to seek medical advice. A doctor can conduct more comprehensive tests and assessments, such as blood tests, brain scans, or cognitive tests to explore other potential causes of memory problems and provide a more precise diagnosis. There are some additional considerations. While the clock drawing test is useful, it's essential to consider other factors that may affect performance. Stress or anxiety can sometimes impair a person's ability to complete the task, leading to skewed results. Vision problems or physical limitations, such as shaky hands or poor eyesight, could also interfere with drawing ability. Educational background. People with less familiarity with clocks or formal education may naturally struggle with the test, even without cognitive decline. In conclusion, the clock drawing test is a simple and practical tool for detecting possible memory or cognitive issues. Its wide use by medical professionals attests to its reliability in identifying early signs of cognitive decline. While not a standalone diagnostic tool, it can be a helpful first step in prompting further investigation, making it ideal for those concerned about their memory or that of a loved one. If you notice any troubling results from the test, it's always best to consult a healthcare provider for a more thorough evaluation and next steps. Doctors typically assess the following key factors. 1. Medical history. Doctors begin by reviewing the patient's complete medical history, including any previous illnesses, medications, and family history of neurological or cognitive disorders. This helps identify potential contributing factors that could mimic dementia symptoms, such as depression, stroke, or certain medications. They also examine the history of memory or cognitive changes and whether they have worsened. 2. Cognitive and mental function testing. A crucial part of diagnosing dementia involves assessing a patient's cognitive abilities. Doctors use various tests to evaluate memory, problem-solving skills, attention, language, and reasoning. Some of the most common cognitive tests include Mini Mental State Exam, MMSE, a widely used test that measures memory, language ability, and orientation. Mini Cog Test. This assesses short-term memory and spatial awareness by asking the patient to recall words and draw a clock. Montreal Cognitive Assessment, a screening tool to detect early signs of cognitive impairment, focusing on executive function, memory, attention, and visuospatial skills. 3. Physical examination. A thorough physical exam helps rule out non-cognitive causes of symptoms. For instance, doctors check for cardiovascular issues, respiratory problems, or infections that could contribute to cognitive decline. PET positron emission tomography scan, sometimes used to detect changes in brain activity, such as reduced glucose metabolism in some brain regions, indicative of Alzheimer's disease. In some cases, doctors may recommend genetic testing, especially if there is a strong family history of Alzheimer's or other dementias. Specific genetic mutations, such as those in the ApoE4 gene, can increase the risk of developing Alzheimer's disease. However, genetic testing is not typically a standard diagnostic tool unless the patient is younger or has a strong family history of early onset Alzheimer's. Doctors also evaluate how cognitive impairment affects the patient's ability to manage day-to-day tasks. This includes assessing whether the individual can manage finances, maintain personal hygiene, navigate familiar environments, and complete everyday activities independently. Declining function in these areas is often a key sign of dementia progression. Diagnosing dementia requires a multifaceted approach. It is not a matter of passing or failing a single test. Instead, it is a thorough assessment that considers cognitive ability, medical conditions, brain history of dementia, past illnesses, medications, and lifestyle factors. Physical condition. Assessing general health, physical well-being, and any conditions impacting memory. Neurological status. Checking reflexes, coordination, and brain function. Cognitive abilities. Evaluating memory, reasoning, and other cognitive skills. Brain imaging and lab tests. Using tools like MRI or CT scans to examine brain structure and blood tests to rule out other conditions. Imaging and overall daily functioning. If dementia is suspected, it is essential to consult a healthcare professional who can evaluate these various factors and rule out other potential causes of cognitive decline. Early diagnosis is crucial for managing symptoms, planning treatment, and improving quality of life. Medical history, including family. Despite these medical procedures, many people, especially as they age, worry about the early signs of dementia and wonder if there are ways to self-screen or perform basic tests at home. While these tests are not a substitute for a full medical diagnosis, they can provide insight into whether further medical evaluation may be necessary. Medical tests. Your first action should always be to consult a doctor who can carry out a series of medical tests, including blood and urine analysis, to rule out other potential causes of memory issues. For instance, memory problems can sometimes stem from conditions like anemia, infection, diabetes, kidney or liver disease, thyroid disorders, vitamin deficiencies, for example, vitamin B12, cardiovascular problems, or high blood pressure. By monitoring your health regularly, such as checking blood glucose levels, if you have diabetes, or using a blood pressure monitor at home, you can identify potential issues early. These health conditions can mimic dementia symptoms, but may be reversible with appropriate treatment. Genetic testing. Specific genetic markers are linked to Alzheimer's disease. Some genes, like ApoE4, increase the risk of developing Alzheimer's, while others are directly associated with the disease. Though doctors typically recommend genetic testing only if there's a strong family history, some people may find peace of mind knowing their genetic predisposition. Armed with this knowledge, they may adopt preventive lifestyle changes like improving diet, exercising regularly, or focusing on brain health. It can be taken at home and is freely available online. It assesses multiple aspects of cognitive function, including problem solving, language, and memory. FDA-approved computerized cognitive tests. Several companies are developing cognitive tests that can be done on computers or mobile devices. One of the most well-known is the Automated Neuropsychological Assessment Metrics, ANAM, designed for widespread use by the military. These tests may soon be available for home use and provide a more sophisticated means of tracking cognitive function over time. NeuroTrack. NeuroTrack is another tool that helps monitor cognitive performance over time. It provides a visual test that tracks eye movements to detect early signs of cognitive decline. Tests like this are available online and may even be covered by insurance. Their web address is www.neurotrackerx.com. Mentrax. Mentrax.com is an online memory test designed to measure how well a person can recall images. It's a quick and fun way to check your memory and cognitive function. The first test is free, and more can be taken as needed. A word of caution: while these home tests can provide valuable insights into your cognitive health, they should never be a definitive diagnosis. They can highlight potential issues, but only a healthcare professional can provide a full assessment and diagnosis. If you or a loved one is concerned about memory loss or cognitive decline, it's essential to seek medical advice to rule out reversible causes and get a comprehensive evaluation. By being proactive with your health and using these tools wisely, you can take control of your cognitive well-being and address concerns early on. If you or a loved one is concerned about memory loss or cognitive decline, it's essential to seek medical advice to rule out reversible causes and get a comprehensive evaluation.
Hey everyone, and welcome back to the channel. Today, we are diving into a topic that affects so many of us at different points in our lives, that feeling of brain fog, or what's sometimes called mild cognitive decline. It's that sensation of not being as sharp as you used to be, maybe forgetting names more often, or just feeling like your mental gears are grinding a bit slower. It can be frustrating and even a little scary. But the good news is, there's a lot we can do to support our brain health right from our own kitchens. And that's what we're going to explore today: natural, simple, and delicious ways to help clear the fog and sharpen your mind. Before we jump in, a quick but important reminder: this video is for informational purposes only. The tips we're sharing are meant to support overall wellness. They are not a substitute for professional medical advice, diagnosis, or treatment. If you have concerns about your cognitive health, please talk to a healthcare professional. They can give you guidance that's tailored specifically for you. It's always best to have a doctor in your corner. Alright, so what exactly is this brain fog? It isn't a medical diagnosis in itself, but rather a collection of symptoms. The same goes for our brains. Giving it the right nutrients can help protect it, enhance its performance, and even support the growth of new connections. Rosemary contains compounds like carnosic acid, which acts as a powerful antioxidant, protecting brain cells from damage caused by free radicals. Some studies suggest that certain compounds in rosemary can help prevent the breakdown of this important neurotransmitter, essentially keeping more of it available for your brain to use. You can even make a simple rosemary tea by steeping a sprig in hot water. The aroma alone is invigorating. Now, let's talk about its cousin, sage. The name sage actually comes from the Latin word suevere, which means to save. Like rosemary, sage is also believed to support acetylcholine activity in the brain. Some small-scale studies have shown that sage extract can improve memory and attention in both younger and older adults. The compounds in sage, like rosmarinic acid, also have anti-inflammatory and antioxidant properties, which are vital for maintaining a healthy brain environment. You can add fresh or dried sage to soups, stews, and sauces. A little goes a long way with its potent flavor. It's amazing to think that these common kitchen herbs hold such potential for our cognitive health. Moving from the herb garden to the fruit patch, let's talk about berries. Specifically, dark-colored berries like blueberries and blackberries. These little jewels are not only delicious, but are also some of the most powerful brain-protective foods you can eat. Their claim to fame is a group of plant compounds called and these are the pigments that give berries their deep blue, purple, and red colors. But they do much more than just make the fruit look pretty. Anthocyanins are incredible antioxidants. Our brains are highly active and use a lot of oxygen, which makes them susceptible to something called oxidative stress. Think of it like rust on metal. Oxidative stress can damage brain cells over time. The anthocyanins in berries act like a cleanup crew, neutralizing these damaging free radicals and protecting our precious brain cells. But that's not all. Studies have shown that a diet rich in berries can improve communication between brain cells. They can also help reduce inflammation throughout the body, including in the brain, which is a key factor in cognitive decline. Some research even suggests that berries can help delay the onset of age-related memory issues. The best part is how easy they are to incorporate into your diet. Toss a handful of blueberries into your morning oatmeal or yogurt. Blend blackberries into a smoothie. Or just enjoy a bowl of mixed berries as a simple, refreshing snack. Frozen berries are just as nutritious as fresh, so you can enjoy them year-round. Next up, let's discuss healthy fats, particularly omega-3 fatty acids. For a long time, fat was seen as the enemy, but we now know that the right kind of fat is absolutely essential for brain health. Our brains are actually about 60% fat, so it makes sense that we need to consume healthy fats to keep them in top shape. The star player here is an omega-3 fatty acid called DHA, or docosahexaenoic acid. So where do we get this amazing brain-building nutrient? One of the best sources is fatty fish. Think salmon, mackerel, herring, and sardines. Eating fish like this a couple of times a week has been linked to better memory and a lower risk of cognitive decline. A handful of walnuts a day makes a great snack or a crunchy topping for salads and yogurt. Other plant-based sources of omega-3 south include flax seeds, chia seeds, and hemp seeds. Finally, let's spice things up with a golden combination: turmeric and black pepper. Chronic low-level inflammation is thought to be a driver of many age-related conditions, including cognitive decline, and curcumin can help combat this. It's also vital for long-term memory. Lower levels of BDNF have been linked to various brain disorders. By increasing BDNF, curcumin may help delay or even reverse age-related brain function decline. Black pepper contains a compound called piperine, which has been shown to increase the bioavailability of curcumin by up to 2,000%. It's an incredible example of food synergy. So, whenever you use turmeric, always try to add a pinch of black pepper. And staying physically and mentally active can make a real difference in how you feel, think, and focus. Start small. Maybe this week you aim to have berries with your breakfast 3 times, or you try a new salmon recipe. Every small step adds up to a big impact on your long-term cognitive wellness. Thank you so much for watching today. I hope you found this information helpful and feel inspired to nourish your brain. If you enjoyed this video, please give it a thumbs up, and don't forget to subscribe and hit that notification bell so you don't miss our future content. I'd love to hear from you in the comments below. What are some of your favorite brain-boosting foods? Stay healthy, stay sharp, and I'll see you in the next video. Does it feel like you're losing a bit of your edge? Maybe opening a jar feels like a wrestling match, or getting up from a low chair takes a little more oomph than it used to. Or maybe you're just not feeling as steady on your feet as you once were. You might chalk it up to just getting old, but there's a real name for it: sarcopenia. It's the quiet thief of our strength that can sneak up as we age. But what if I told you that you could fight back? And not with some miracle pill or a brutal workout plan, but with the delicious food you put on your plate. In this video, we're unveiling 10 easy-to-find foods that act as your nutritional armor against muscle loss, helping you stay strong, vital, and independent for years to come. Sarcopenia is the official term for the loss of muscle mass, strength, and function that happens as we get older. It's a major reason why many older adults find it harder to get around and have a higher risk of falls and fractures. Without taking action, adults can lose a serious chunk of their muscle mass each decade, and this process really picks up speed after 60. It is estimated to affect anywhere from 10 to 50% of older adults. This can mean losing your independence and making it tougher to do the things you love. Whether that's playing with grandkids, tending to your garden, or even just carrying groceries. But this is not a one-way street. A big part of why this happens is a phenomenon called anabolic resistance. Think of it like this: when you were younger, your body was a superefficient factory, taking the protein you ate and using it to build muscle. As you get older, the workers in that factory get a little hard of hearing. You need to speak louder by giving them more high-quality protein to get the same job done. And that's where your diet becomes your superpower. The solution isn't just eating more. It's about eating smarter. We're going to talk about specific foods that are not only loaded with protein, but also contain other key nutrients that tell your body, hey, wake up and build some muscle. So, let's get into the 10 foods that will help you build your nutritional armor. Kicking things off, we have Greek yogurt. And for good reason. A single cup can be packed with 13 to 20 grams of high-quality protein. What makes it a double threat is that it's rich in both whey and casein. Whey is the fast-acting protein that gets to your muscles quickly to start repairs, while casein is the slow and steady protein, releasing amino acids over several hours. It's the perfect 1-2 punch for muscle maintenance. Some studies have even found that having casein-rich dairy at night can improve overnight muscle recovery in older adults. On top of that, Greek yogurt has probiotics for a healthy gut, which helps you absorb all those good nutrients even better. Just be sure to grab the plain, low-fat kind to skip the added sugar. They're often called nature's perfect protein, and for fighting muscle loss, eggs are a true powerhouse. One large egg gives you about 6 grams of complete protein, meaning it has all 9 essential amino acids your body needs to repair muscle. But the real magic is in an amino acid called leucine. Think of leucine as the ignition key for muscle growth. It's the specific trigger that tells your body to fire up muscle protein synthesis. Studies show that older adults who eat leucine-rich foods can see real improvements in their muscle strength. Plus, the yolk is a great source of vitamin D, which is vital for muscle function. They're cheap, versatile, and an incredibly simple way to boost your muscle-building power every day. Just like Greek yogurt, low-fat cottage cheese is a total protein champion. A 1-cup serving can deliver a whopping 25 grams of protein, mostly in the form of casein. As we just learned, casein is a slow-release protein, which makes cottage cheese the perfect snack before bed. It works through the night to prevent your muscle from breaking down while you sleep. keeping your body in a muscle-building state for longer. It's also a fantastic source of calcium, which you need for healthy bones and muscle contractions. Try it with some fruit or a handful of nuts for a delicious and powerful snack. Next up, fatty fish, like salmon, mackerel, and sardines. You should aim to get these on your plate 2 to 3 times a week. A 3.5-ounce serving of salmon alone offers around 22 to 25 grams of top-tier protein. But its real secret weapon is the high concentration of omega-3 fatty acids. As we age, our bodies can have low-grade chronic inflammation that gets in the way of building muscle. Omega-3 South are powerful anti-inflammatory agents that create a better environment for muscle growth and have been shown to improve muscle strength and function in older adults. They help preserve your muscle quality and can even reduce some of that soreness you might feel after being active. Lean meats like skinless chicken and turkey breast are the bedrock of a muscle-preserving diet. A simple 3-ounce serving of chicken breast packs about 28 grams of lean protein. And just like eggs, this protein is incredibly rich in leucine, that all-important amino acid that acts as the green light for building muscle. Research consistently shows that getting about 20 to 30 grams of protein in each meal is the sweet spot for overcoming that anabolic resistance in older adults. Adding a portion of grilled chicken or turkey to your lunch or dinner is a simple and tasty way to hit that target and give your body the building blocks it needs. Now, before we get to our final 5 foods, if you're finding this information helpful, do me a favor and hit that subscribe button. We're all about bringing you science-backed tips to help you live a stronger, healthier life, no matter your age. You don't have to be a metator to build muscle. Plant-based proteins like beans, lentils, and chickpeas are absolutely fantastic options. A single cup of cooked lentils gives you about 18 grams of protein and a massive 15 grams of fiber. Believe it or not, studies have linked higher fiber intake to better muscle mass and strength in older adults. When you combine legumes with a whole grain, like our next food, you create a complete protein with all the essential amino acids. These foods are also loaded with magnesium, a mineral that plays a huge part in how your muscles work and produce energy. Speaking of quinoa, this ancient grain definitely deserves its own moment in the spotlight. Unlike most other plants, quinoa is a complete protein all by itself, which is pretty special. A 1-cup serving has about 8 grams of protein and 5 grams of fiber. It's also a treasure chest of important minerals like magnesium, iron, and manganese, which all help with energy and muscle health. Quinoa is so versatile. Can use it as a base for a salad, a side dish for dinner, or even a warm breakfast bowl. For a powerful, muscle-friendly snack, nuts and seeds are where it's at. Almonds, walnuts, chia seeds, and flax seeds are not just a good source of plant-based protein, they're also brimming with healthy fats, fiber, and antioxidants. Walnuts and chia seeds are especially high in omega-3 South, which, as we know, help fight inflammation and protect your muscles. Just a small handful of almonds gives you around 6 grams of protein. Seeds like chia also provide calcium and magnesium, giving your muscles and bones even more support. Sprinkle them on your yogurt, toss them in a smoothie, or just grab a handful for a snack. Protein gets all the attention, but we can't forget about the supporting cast. Leafy greens like spinach and cruciferous veggies like broccoli are packed with antioxidants, like vitamins C and E. These antioxidants help fight something called oxidative stress, a natural process that can speed up muscle aging. Plus, these greens are a source of dietary nitrates. Your body converts nitrates into nitric oxide, which helps improve blood flow. Better blood flow means more oxygen and nutrients can get to your muscles. Some research even suggests certain compounds in spinach can give a modest boost to muscle mass and strength. Finally, let's add some vibrant color to your plate with berries and citrus fruits. Blueberries, strawberries, and oranges are bursting with vitamin C. Vitamin C is essential for producing collagen, which is the main structural protein that makes up your connective tissues, including the scaffolding inside your muscles. A strong collagen framework is key for healthy, resilient muscles. These fruits are also loaded with antioxidants that help reduce inflammation all over your body, creating the perfect environment for muscle health and vitality. So, there you have it, 10 powerful and delicious foods to help you win the fight against age-related muscle loss. We've covered everything from the protein powerhouses like Greek yogurt, eggs, and fatty fish to the vital nutrients in leafy greens and berries. The main thing to remember is that you are in the driver's seat. By adding these foods to your meals, you can actively push back against anabolic resistance and give your body the exact tools it needs to maintain and even build muscle. The goal is to aim for around 25 to 30 grams of protein at each meal, spread throughout the day. In fact, many experts in aging now recommend that older adults get 1.2 to 1.5 grams of protein per kilogram of body weight each day to best preserve muscle. This isn't about a restrictive diet, it's about making smart choices that empower you. Start small. Pick 2 or 3 foods from this list and work them into your meals this week. You have the power to protect your strength, your mobility, and your independence for all the years ahead. What's your favorite muscle-building food? Let us know in the comments below. And if you found this video valuable, please give it a thumbs up and share it with someone you know who could use this info. Don't forget to like and subscribe and hit the notification bell so you don't miss our next video. Thanks for watching, and here's to your health.